And thank you for joining us. Here with us today is Dr. Wang, pain management physician at Meadville Medical Center and the 2024 MMC Philanthropist of the Year. Dr. Wang, thank you for joining us.
Thank you.
Well, congratulations on that. That's quite an honor.
Well, yes. I was very surprised when they announced my name.
Well, and we could talk a little bit about that here in a little bit, but before we do that, why don't you tell us a little bit about yourself?
Well, I'm doing pain management, and I came to MMC 5 years ago. And before that, I had my training at anesthesia at the Mass General Hospital, then did my fellowship training at Cleveland Clinic. So I first went to UPMC for a few years, then decided to move on for a more comfortable setting to practice. So then eventually I ended up with the MMC. And it's been 5 years. I really enjoyed this 5 years experience here, and it makes me feel very comfortable doing my daily job. I don't need to worry about much things, and I totally felt this is a really good decision 5 years ago.
Well, so how old were you when you knew that this was the direction you wanted to go?
You mean before?
Yeah.
I was not very sure this is the place I want to come, in the beginning. But then I went through the recruiting part. I talked to a lot of people, and particularly the hospital, the administration staff. And really, they make me feel like this is almost like a home feeling. And then I decided to give myself a chance. And since the main reason at that time I was not so sure because my family live in Wexford. It's over an hour drive. I don't know if I can do that for for my daily work. But once I start working here, and I really think this is a place I wanna I wanna finish my career.
That's fantastic. Well, let's go back even further. As a kid growing up, is this the direction you wanted to go? You wanted to be a doctor?
No, I don't know. I mean, it's a little different system. I came from China, and at that time, it's not the same system as the U.S. And we have this like a national-wide matriculation exam, and then based upon your score, you can apply different college, university, different program. And so it's not all only about what you want to do, it's all about how you good with your test performance. So at that time, I did my exam, I did very well, and then my family and my parents always want me to be either going some a business kind of a route, but I just don't feel like I'm that kind of person. And I was the first one in my family and decided to go through the medical route. And so my parents were supportive, but they were not sure if that fits me. But now look back, and I think this is definitely some career. I think I can, at this point, I can say this is the best route I can take.
That's fantastic. So just growing up in that experience and to where you are now, what sort of things have you always taken with you? What sort of things have been in the back of your mind as you've gone through this process?
Well, I think the most important thing is, being in the medical field, you really need to have a very, strong mindset. And, the training is very brutal. And for me, it's especially, a longer journey for most people have training, they grow up here, they have training here. So I did my medical school back in China. Then I was doing a neurosurgery residency. The life was miserable, and I barely see sunshine. It's just like you just on call, then a post call, then you still need to do a lot of work, and then you on call again. So, and then back in '96, I decided to come to the U.S. I tried to explore some, research opportunity, and that's how I ended up with pain medicine. And I did a lot of basic science about the pain, the mechanism, what's the treatment option available. And then I decided to go back to the clinical part. So I have to retake all the exam. And then I go through the residency training. By that time, I'm already belong to the like an old age group. I mean, I was like a 36 that time, and most of my co-residents, they only like they're like a late 20 or early 30. So I was definitely an old guy.
But with experience, though.
Yeah. So, and you still need to, you need to do the same thing and take a call. And in the meantime, I have family, I have kids, and you have to also do your, you fulfill my responsibility as a parents. So that's really a difficult few years. I think certainly my family gave me a lot of support, but also in the meantime, I think, being like a very goal-driven and very, just being believe, and through all those challenge, eventually I can reach the area, the spot I want to be. So I think that's very important. That's that's how carries me through those few years of very miserable residency life.
Well, you mentioned the family support. It sounds like family is sort of key.
Yeah.
So coming here and having that family atmosphere and having patients that view you almost as family, right?
Yeah.
How does that feel, knowing that they weren't just a number, they had a name?
Yeah, I mean, that's also something very, critical. I mean, the hospital, I've been working with several different hospitals, and this is the hospital I really felt like a family feeling. I mean, as an example, I had my 55th birthday 2 days ago. So, and I received a handwritten, card from Dr. Kraling. Oh. I was like, I would never expect this thing from other hospital, and it's really make you feel like you are not just like a number, and you are really part of the big family, and certainly that's the way how I try to treat my staff, also treat my patients. So. Most of my patient population, they are like at a very advanced age. I see a lot of people at 80, 90, even 100. So, and they have a lot of pain issue, and that's the area I can provide my expertise. So when I treating them, I always feel like I just thinking my parents. My dad is 93, my mom is 88. So they are very similar age group, and I know how much they suffer. And therefore, I always try to treat them as my parents and help them whatever way I can. I think that's really give me a lot of rewarding feeling. A patient that likes that, and also making me feel like the job I do is very meaningful.
So when you have patients come in, and probably rare to see younger folks, right? But
very rare.
Okay, but if you're 20s, 30s, what are some things they're coming in to see you about?
So for most those young age people, they are mostly have like a acute kind of like disc herniation. That's sometimes most of them are doing some sports, and suddenly they feel pain shooting. Those are young age people, and also for those people, the treatment can be very effective because they are not chronic phase, and a lot of time 1 or 2 injections, I never see them back again. So they can help them avoid doing like a major back surgery. So that's more for most young folks. I don't see a lot, but those are the folks I feel like with this procedure, orientation can be more effective.
And then as you get 40s and 50s, what are you starting to see there?
Well, then they will, since they work too hard through their and through their life, and they develop more chronic pain issue, and then gradually they become my routine visitor, and in those situations, so I have, we more often establish like a long-term relationship, and I see those people for a really long time.
So as you get into those patients of yours who are in their 60s, 70s, and 80s, the course of treatment obviously is a lot different than, as you said, those younger ones.
Yes.
So what goes into those conversations with patients, maybe in that older age group?
So for older age group, the first thing I want to let them understand, even we can do a lot of different ways, but they may still have like pain issue. It's become chronic. Basically, once you from acute pain from this young age and to gradually developing those chronic pain for older age population, and the nerve different way. In the young age, the nerve only is just like a responder, and they respond to your injury, and they don't create the problem for yourself. They just carry the message to say, hey, there's a pain issue in the area. But when you have this problem ongoing for years, then the nerve not only become just a messenger, they self become like an offender. They will involve a lot of pain problem. And so that makes things more difficult to treat. And that's why we see those patients for long term, because the nerve is being, wrongfully trained to continuously sending the message to your brain you have pain, even that location and the local problem already fixed. But the nerve just memorize that, and they will continue tell you you have pain in that area.
And I was just going to ask, sometimes if somebody comes in and says, well, I'm feeling pain in a certain area, and you're looking somewhere else, and they're thinking, well, why aren't you looking here? Well, it could be because it's coming from somewhere else.
Yeah, right, yeah.
So what, and I'm sure every patient's different, right? So you are looking at everybody individually, and the course of treatment is going to be different for everybody.
Right, correct. Yeah, I mean, so when patient come in, they may have a very, very simple description. I have back pain, but actually, if you look into it, there's a lot of different reasons can causing a similar symptom. So that's why, as a physician, one of our major job is doing differential diagnosis. So not the pain are the same, and even with similar complaint, and you can, have different reasons. I mean, for example, you may have muscle problem, or you may have joint problem, or you may have nerve problem. All those things you need to treat differently. So it's not like a one size can fit all.
How much has changed in your field in terms of diagnosis and treatment in the last 20 years?
Oh, it's a huge progress. When I was in my training, and there's very few options we are doing now. And honestly, I can tell, I mean, half of my procedure doing on daily basis now, I learned after I finished my training, but that time not even available. And that's the part of life as a physician. You not just finish school, you're done. You need to continue to learn. There's so many new technology available. Like for spine, when I was in training, we only have some injection as an option. But nowadays, you have a lot of minimally invasive procedure. And you can, target in different parts of the spine issue. And you can offer a much better treatment.
It probably doesn't amaze you with so much that has changed, but even in the next 20 years, I'm sure there's lots of things that are on the horizon.
Oh yeah, definitely. I mean, I think the whole medical field is for the same, route. From more invasive become less invasive, and then you can pinpoint to the etiology way more accurate than it used to be. So that's definitely the trend. I mean, I can clearly see. I mean, for example, the most common thing we do as one of the advanced procedure is doing the neuromodulation. We can target certain nerve and deliver electrical stimulation to control the pain. And when I was in my training, and it's a very basic, technique, but nowadays it's such an advanced, almost like a computer. I mean, like 10, 20 years ago, we still use like a big dose like a desktop, but not how often people still using that. It's all become like everything the cell phone.
Yes, yes. Which good and bad, right? I'm sure you have people that come into your office and say, "Well, I looked up my symptoms." Is that okay, or should people actually sit down and have a conversation with you?
I think there's some pros, there's some cons. I mean, there are people not, they have some knowledge to go into the treatment. So it's easy for you to explain why I do that. So they have certain knowledge. But sometimes, when you look at the website, it may not be all accurate telling things. And can be very misleading. Like a very common patient come to me to the epidural injection. Oh, they say, would I be paralyzed? I read all those online, the Google, the horrible story. I say, yes. I mean, if things really, really goes wrong, that could happen. I cannot say never happen. I mean, it's possible. But the thing is that if someone with enough training doing the procedure, I mean, those things happen, the chances are very, very rare. So I feel like a patient, need to be very smart using this information, help them, not harm them.
Yeah, absolutely. So now how do you get your patients? Is it through somebody talking to their PCP? Is it calling you direct? How does that work? So
we are specialty office, so therefore we don't take those like a direct, like a walk-in kind of thing. Most patients need a referral. And either from family doctor. So also we have close relation with orthopedic spine. I mean, those are also a major reason for the referral.
my understanding is you made your way out onto a basketball court recently with some colleagues.
Yes.
Did you have to provide any pain management for them afterwards?
Oh, thankfully, I don't need to.
Okay, all right. Because I hear it was quite a beating. You guys took on a Maplewood basketball team, a ladies basketball team. So
yeah, those girls
they're very talented girls, aren't
are physical.
Yes. So, do you enjoy doing stuff like that?
Yeah, I play basketball myself and both my boys. I train them and I play together with them, quite often. But certainly now they're teenagers. I cannot compete anymore with them. But I always have a passion to watch them play basketball. And I still hope my body can help me, to play a few more years.
Well, and I have a feeling you have these conversations with your patients. Maybe something to the effect of, well, you're not as young as you used to be.
Yeah.
So.
Yeah. Yeah, exactly. So therefore, be smart. What thing your body allow you to do, don't overdo it.
Absolutely. So in addition to that, what are some other things you do to relax?
Well, I like to travel, and so I like to really, go to those different parts of the world and to see different things, different culture, experience different kind of environment. And certainly, I watch a lot of sports games. And
what's your favorite sport?
Basketball, yeah. And also in the next, in the past few years, since both my son they're growing up, and I really spend a lot of time trying to to teach them and to help them develop their kind of interest.
You mentioned traveling. You visited places like Africa, Haiti. Talk about those trips, because those are quite special.
Right. So, I joined those like a medical mission trip. And those things start from, I would say maybe back in 2017. That's the time, we have doctor, we have some kind of like a group. And I heard one of the story, and one of my colleagues, he joined our organization, went to Africa and went to Senegal. So the local doctor went with him together. But unfortunately, in the middle of nowhere, and that doctor had developed some heart attack and basically passed away in the way of mission trip. That was a very a touching story. And when he returned to the U.S., he tried to tell everyone. That's the ultimate sacrifice, and as a doctor doing medical mission. So that's the story. Really, getting me into this medical mission. I feel like I'm one of the lucky person. I came to the U.S. and after number of years training, I'm able to do continue my career as a physician. I provide help, but in the meantime, people here living a much high quality of life, and compared to some place, they barely have medical, resource. So that's why I feel like I need, if possible, I can return to those, those more needed population. So that's how I started my medical mission trip, and I've been to Haiti, and I've been to Senegal, and I've been to Cambodia. And unfortunately, COVID have everything on hold for 3 years, and finally we started back to those mission trip again.
How often do you go?
I usually try to go once a year at least, and sometimes go twice a year. Like last year, I went twice, and so those mission trip, I feel like it's important we're not like try to acting as a savior. And more important, you go to share the same kind of suffer with local people. I think that's more important for me to go into that.
What's the biggest takeaway? What's the biggest lesson you've learned by traveling and visiting and hearing those stories?
The most important is I just feel like how lucky I am, and I be able to live this country. And but it's lots of people from other parts of the world that they nowhere near the level of quality of life we're having now. So, and when we look at that, I felt very compelling when you see that in Senegal, for example, it's a very dry. It's sub-Sahara area. It's very, very dry. The water is a major problem. The time when we went there was in the dry season. So the whole village, about like several hundred population, they have 4 wells, and 3 of the wells get dried already. You cannot see any water. Wow. So the only 1 well left. It's barely has some water. I mean, we even try use the bucket to try to get the water, and you go very, very deep and get a little bit of water. It's all muddy water, but that's only drinking water for the whole village. So they never have a chance to take a shower until the rainy season, and they never have a habit to wash their hands. That's why the people having a lot of health issues just from like a clean water supply, but that's all they have. I mean, those infrastructure, it's basically it's just not even existing. I mean, we think that tap water is a must, but for that local population, I mean, that's the only water is from this very muddy water.
Do you take supplies over from here? Or
Yeah,
how does that work?
We take a supply like medicine and from here, and to go there and try to do some surgery, do some like provide some like medication, and so that's also a big challenge. I feel like for medical mission, we can only go there for a certain number of days a year, and we cannot carry everything there. I mean, that's why we only can do a very limited procedure surgery, and also provide a limited supply of medication to the local people. I just feel like the more important, how can make this thing become more sustainable for the locals, not just like once, twice a year.
What's the support been like for you to go on a mission like that?
Well, I mean, we talk to a lot of those like pharmaceutical company, ask them see if they can donate something. Also, I get some support from the hospital, and I can carry some kind of surgical supply to there. And then also, all the people participating, they donate, and they try to have more of a funding, can buy some things if we cannot get it from other source to go there. And then we contact the local hospital, and to see if we can use their resource, I mean, like OR, those things. And usually they are fairly, welcoming us. But sometimes you also have some kind of like administration, some legal kind of barrier. Mm-hmm. That's always a problem, a challenge. So we try to establish more of our own base, and just to set up our own surgical center. Then it will be a lot easier to do things more in a more continuous basis.
It's been an absolute pleasure getting to know you and learning about you and your talents shared not only here in Meadville, but across the world. So
thank you.
Thank you. It was a real pleasure. Before we wrap up, the favorite basketball team? I didn't ask you that.
My favorite basketball? UNC.
Okay, there you go. Thank you so much for joining us.
Thank you.
All right.
Yeah.
And thank you for joining us.